central government has issued advisories to the state government considering the uptick in the COVID-19 cases and also how one case of JN.1 has in fact been detected in Kerala. Now, what is the overall situation of COVID-19 in India? There are over 170 fresh cases that has been reported, but the majority of the cases are being reported from Kerala. And we have also in fact been informed by the Kerala Health Department that one case of JN.1 variant, which is a lineage of BA2.86, has in fact been detected in a 79-year-old woman. Now, after that, we are seeing that the Health Ministry has swung into action. They have asked all the state health departments, all the state government to ensure that there is close vigil that is being done, considering how it is a festival season, the Christmas is around the corner and the New Year is also just few days away. Considering that, there should in fact be monitoring of the situation as far as COVID-19 is concerned. Crowd management should be one of the focus of the state governments. Now, apart from that, they have also been advised, all the state governments have been advised that they need to ensure that any sort of influenza-like illness or severe acute respiratory illnesses, all these cases should be reported, they should be closely watched. Apart from that, the RT-PCR test needs to increase, antigen test needs to increase. There is going to be a recommended number of samples, positive COVID-19 samples that need to be sent to INSAGOG as well as NIV Pune to determine if there is any kind of new variant or the variant, the JN.1 that we have been talking about. Now, apart from this, there is also going to be mock drills that needs to be conducted in all primary health departments, also in hospitals, is what the central government has advised. So, in this particular guideline, they have also in fact described, the central government has described JN.1 as a variant of interest that has been considered by the WHO. They also have been pointing out that how JN.1 is immune evasive. It is highly transmissible, but at the same time, it is mild variant. So, there is no panic situation, but at the same time, we have to ensure that all the guidelines are followed on ground. That includes the distancing ourselves from the crowded places, wearing masks when necessary, washing your hands, the hygiene needs to be kept in mind. All these are part of the guideline. They have also in fact asked all the state governments to ensure that whatever positive samples are coming, the recommended number are supposed to be sent out to NIV Pune to determine whether there is a rise in JN.1. So far, we have only seen one case of JN.1 in India. In case it increases, then there needs to be a proper monitoring of the situation, and hence the situation should not go out of hand, is what the advisory of the central government is that. Meanwhile, the central government is also planning a review meeting, which is on 20th on Wednesday. There will be a review meeting by the health ministry. It will include all the health department, health ministry seniors and official bureaucrats who will be part of this meeting. Union Health Minister Mansukh Mandavia himself will be heading and chairing this particular meeting. And whether there is need to be a travel ban, whether there needs to be a travel restriction, all this will in fact be decided in this particular meeting that is supposed to take place on 20th.